Well, you know, the first rule for any kind of a market structure is that it work effectively. I mean, healthcare is a very precious commodity. If you take a look at the inefficiencies in inequities in providing healthcare in America, most of them are born out of misguided public policy. President Obama thinks that if the government just takes over healthcare, you're going to improve the availability and of healthcare facilities to the American people. He's simply wrong. It won't work that way. So my biggest problem with it is that you will diminish the quality of healthcare. One of the things that irritates me about this debate, and I'm going to say this very clearly, and with no doubt or reservation in my mind, the American people enjoy the greatest health care in the world. And in addition to it being the highest quality of health care available to the people of the United States, it is more generally and conveniently available than in any place in the world. And it is the most innovative healthcare system. That is to say, virtually all new discoveries of procedure and medications are born in the United States. The rest of the world gets to live off our inventiveness. Now, if in fact you bring the American healthcare system under the control, administration of the federal government, you take out the inventiveness. And so the world will then have stagnation in new healthcare discovery. Because if you shut down America, you got to ask yourself, if it doesn't come from America, where's it going to come from? The fact is, it isn't coming from any place but America. Government will shut that down because, as first said by Shakespeare, if it can't be sold for a profit, it's not worth writing. And then by Alva Edison, if it can't be sold for a profit, it's not worth inventing. If you take away the opportunity for a profit, you are going to shut down the willingness to invent. And so I'm frightened for the healthcare security of the American people over the misguided notion that the federal government can run and administer a healthcare system.